Hello, I'm Dr. Justin Grannell. I'm a family medicine provider for Beacon Medical Group Bristol. One of the hot topics in medicine these days, and has been for a while, is type 2 diabetes. It is approaching close to 50% of all Americans have either prediabetes or type 2 diabetes. This is definitely different than type 1 diabetes. Type 2 is generally reversible through diet, exercise, and weight loss. Type 2 diabetes places you at increased risk for multiple medical conditions, putting you at risk, significant increased risk of heart attack, stroke, kidney failure, infections. And so if we can identify this condition early on through your yearly Medicare or commercial insurance physicals, we can treat it early and hopefully prevent these complications down the road. Some general information regarding type 2 diabetes. There are several ways to diagnose this, one of which is a fasting blood sugar, actually technically 2 or 3 of them over 126, or a non-fasting greater than 200, but a number we often use that everyone's familiar with nowadays is the hemoglobin A1C. That is a general average number that gives you an idea of where your sugars have been on about a 3-month period of time. And once you hit 5.8 up until 6.5, that is what we call insulin resistance or prediabetes. Once you hit 6.5 and higher, that is officially diabetes. Some symptoms of diabetes, type 2 specifically we're talking about here. When it's mild, oftentimes you probably wouldn't notice many symptoms at all, but as your sugars start to get higher, you can notice vision changes, you become excessively thirsty, you pee a little more than you're used to. And those are some signs that if you are noticing happen, should prompt you to call your physician so you can get in and have that tested to make sure that's not going on for you. For my patients with type 2 diabetes, as long as the numbers are not horribly high, lifestyle modifications are always the first choice, the first step in treating this to try and improve this. After that, generally, what we use is unfortunately oftentimes dictated by insurance, but metformin is a first-line medication, and there are multiple other medications we can use without having to go to insulin. We have our SGLT2 medications, we have our GLP-1 medications that everyone seems to be so enamored by for weight loss, but all of which are different tools in our toolbox of treating and trying to tackle this condition. However, it is definitely worth noting again that the first line, even if you are put on medications, is to try diet and exercise. You can Google diets, you can talk about diet with your provider, we can get you to diabetic educators to help you with this as well. So there are many ways that we can go about doing this, but overall, type 2 diabetes is reversible. It's important for everyone to have a primary care physician. They're the ones that are going to be doing your yearly physicals and doing the screening tests and getting you to any specialist you may need to see. If you do not have one, feel free to go to beaconhealthsystem.org, and there should be a list of providers who are accepting new patients, and we even have the ability for you to schedule yourself online if you feel comfortable doing that.